Have you ever walked into a clinic and felt like the doctor already knew something was wrong even before you said a word? It's not magic. It's observation. Doctors are trained to notice subtle signs, and your hygiene habits might be quietly revealing more than you think. In this video, we'll explore 7 hygiene mistakes that doctors say could be red flags for your health. Some of these are surprisingly common and you might be doing them without realizing. Ready to find out what your daily routine says about your well-being? Let's dive in. First up, let's talk about your breath. We all worry about bad breath, or halitosis, after a garlicky meal. But what if it's persistent? No matter how much you brush or use mouthwash, this could be a major red flag for doctors. Chronic bad breath isn't just about what you ate. It can be a sign of underlying issues like gum disease, which is a serious infection that can damage your gums and even destroy the jawbone. It could also point to sinus infections or problems in your digestive system, such as acid reflux. In rarer cases, a specific scent on the breath can signal something more serious. For example, a fruity smell can be a sign of diabetes, while a fishy odor might indicate kidney problems. So, if your bad breath just won't go away, it's not just an embarrassing social problem, it's your body's way of telling you to see a doctor. Don't just cover it up with mints. Get to the root of the issue. Mistake number 2. Neglecting your fingernails and toenails. Your nails can be a window into your overall health. Are they brittle, discolored, or have an unusual texture? Doctors notice these things immediately. Yellow, thick nails can be a sign of a fungal infection, which can be stubborn to treat if left alone. Small pits or dents in your nails might be linked to conditions like psoriasis. A dark streak underneath the nail, while it could be from an injury, it's also something that should be checked out by a professional to rule out more serious possibilities. And don't forget about nail biting. It's not just a bad habit. It transfers germs directly into your mouth and can damage your teeth and the skin around your nails, opening the door for infections. Clean, well-kept nails aren't just for looks. They reflect good internal health. Moving on to the 3rd hygiene mistake. Overlooking your skin's signals. Your skin is your body's largest organ, and it's constantly communicating with you. Persistent acne, especially in adults, might not just be about clogged pores. It can be a sign of hormonal imbalances or high stress levels. Are you noticing excessively dry, flaky skin that doesn't get better with lotion? This could point to a nutritional deficiency, like a lack of omega-3 fatty acids, or even an underactive thyroid. On the other hand, unusually oily skin can also be linked to hormonal fluctuations. Eczema or sudden rashes are your immune system's way of reacting to something, whether it's an allergen in your soap or a food sensitivity. When a doctor sees these skin issues, they're not just thinking about a topical cream. They're considering what's happening inside your body. Number 4 is a big one. Poor dental hygiene that goes beyond just cavities. Not brushing and flossing regularly is a mistake we all know about, but doctors see the deeper implications. As we mentioned with bad breath, neglecting your teeth leads to gum disease or gingivitis. If you notice your gums are red, swollen, or bleed when you brush, that's an early warning sign. If left untreated, this inflammation can spread throughout your body. In fact, studies have shown a strong link between poor oral health and an increased risk for heart disease. The bacteria from your mouth can enter the bloodstream, causing inflammation in the blood vessels and contributing to serious cardiovascular problems. So when you're flossing, you're not just preventing cavities, you're protecting your heart. A healthy smile is a key part of a healthy body. Let's talk about mistake number 5. Ignoring your body odor. Everyone has a unique scent, and it's normal to have some body odor, especially after a workout. But a sudden, strong, or persistent change in your body odor is something to pay attention to. If you find that your sweat suddenly has a much stronger smell, even with regular washing and deodorant use, it could be a signal. Sometimes, changes in diet can affect your scent, but it can also be linked to medical conditions. For example, certain metabolic disorders can cause unusual body odors. Stress and anxiety can also ramp up production from your sweat glands, leading to a stronger smell. While it might feel embarrassing to discuss, mentioning a significant change in your body odor to a doctor can provide a crucial clue to what is happening with your health. Don't just mask it, investigate it. Mistake number 6 might surprise you. You're not cleaning your personal items properly. I'm talking about things you use every single day. How often do you wash your bed sheets or your bath towel? These items are breeding grounds for bacteria, dead skin cells, and dust mites. Sleeping on dirty pillowcases can contribute to acne and allergies. Using a damp, unwashed towel can spread bacteria right back onto your clean skin. But it goes beyond your linens. Think about your phone, your keyboard, and your water bottle. These are hotspots for germs that we touch constantly and then bring to our faces. A doctor might not see your dirty sheets, but if you have recurring skin infections or illnesses, they might start asking questions about your environment. Keeping your personal space and items clean is a fundamental part of staying healthy. Finally, mistake number 7. Inconsistent or improper bathroom habits. This is a private topic, but it's incredibly important for your health. Doctors often ask about your bowel movements and urination because they provide a ton of information. Are you experiencing chronic constipation or diarrhea? The color, consistency, and frequency of your stool can indicate everything from dehydration and a lack of fiber to more serious digestive issues like irritable bowel syndrome or Crohn's disease. Similarly, the color of your urine is a simple way to check your hydration levels. Dark yellow urine means you need to drink more water. But if you notice a persistent change in color, or if it's cloudy or has a strong odor, it could be a sign of a urinary tract infection or a kidney problem. Paying attention to these daily functions and discussing any lasting changes with your doctor is a crucial hygiene practice that directly impacts your long-term health. So there you have it, 7 hygiene mistakes that are more than just bad habits. They're potential red flags for your health. From persistent bad breath and nail changes to skin issues and neglecting your personal items, these subtle signs can tell a doctor a lot about what's going on inside your body. The goal here isn't to make you paranoid, but to empower you. By paying closer attention to your body and your daily routines, you can catch potential problems early and take a more proactive role in your health. Your body is always communicating with you. You just have to learn to listen. Let's start with number 1. Neglecting your oral health. We all know we're supposed to brush twice a day and floss, but life gets in the way. However, if you're consistently skipping it, it's a major concern. Beyond the obvious cavities and bad breath, poor oral hygiene is linked to serious health problems. Your mouth is a gateway to the rest of your body, and bacteria from inflamed gums can enter your bloodstream. This has been linked to an increased risk of heart disease because the inflammation can contribute to clogged arteries. It can also worsen conditions like diabetes by making it harder to control blood sugar. So, if your gums are bleeding, your breath is constantly bad, or you just can't remember the last time you flossed, it's not just a dental issue, it's a whole body health warning. Next up, number 2, irregular showering. Now, I'm not saying you need to shower every single day. In fact, for some skin types, that can be drying. We're talking about a noticeable shift in your routine. If you used to be a daily shower person and now you're going days without, it's a classic sign doctors look for, especially when assessing mental health. A lack of motivation to perform basic self-care tasks, like bathing, is a hallmark symptom of depression. It's not about being dirty. It's about a profound lack of energy and interest, a condition known as anhedonia. Beyond mental health, infrequent bathing can lead to skin problems. The buildup of sweat, oil, and dead skin cells can clog pores, leading to acne, and can create a breeding ground for bacteria and fungi, causing infections or rashes. The third mistake is wearing the same clothes for days on end, especially underwear and socks. It might seem harmless, especially if you're working from home, but your clothes, particularly the layers closest to your skin, absorb a lot of sweat, oil, and dead skin cells. Rewearing them creates a warm, moist environment perfect for bacteria and yeast to thrive. This can lead to some pretty uncomfortable situations like jock itch, athlete's foot, or yeast infections. It can also cause body acne and skin irritation. From a doctor's perspective, this habit, much like infrequent showering, can also signal mental health struggles. When someone loses the energy to do laundry or even pick out a clean outfit, it can point towards depression or overwhelming fatigue. It is a small detail that tells a much bigger story about a person's state of mind and well-being. Let's move on to number 4. Ignoring your nail health. Take a quick look at your fingernails and toenails. Are they clean, trimmed, or are they long, dirty, or showing signs of discoloration. Neglected nails are more than just a cosmetic issue. The space under your nails can harbor an incredible amount of dirt and germs, including bacteria like Salmonella and E. coli. If you bite your nails or even just touch your face, you're transferring those germs directly to your mouth and skin. Furthermore, changes in your nails themselves can indicate health problems. Yellow, thickened nails could be a sign of a fungal infection. Brittle nails might point to a thyroid issue or a vitamin deficiency. A doctor will notice these things during an examination, as your nails provide a visible window into your systemic health. Mistake number 5 is sleeping on dirty sheets. How often do you wash your bedding? If the answer is not often, you might want to reconsider. Every night, you shed thousands of dead skin cells, sweat, and body oils onto your sheets. This creates a feast for dust mites, microscopic creatures whose waste products are a major trigger for allergies and asthma. Lying in this environment, night after night, can lead to skin irritation, acne breakouts, and allergic reactions like sneezing, a runny nose, and itchy eyes. For someone with a compromised immune system, it could even lead to skin infections. When a patient comes in with persistent allergies or unexplained skin rashes, one of the first lifestyle questions a doctor might ask is about their bedding hygiene. It's a simple change that can have a huge impact on your health. Number 6 is something many of us are guilty of. Improper hand wash. We've all heard it a million times, especially over the last few years. But are you really doing it right? A quick rinse with water isn't enough. The CDC recommends scrubbing with soap for at least 20 seconds. Why? Because that S, how long it takes to effectively remove germs that cause everything from the common cold and flu to more serious gastrointestinal illnesses. Doctors often see the consequences of poor hand hygiene, especially during cold and flu season. If you find yourself getting sick frequently, your hand-washing habits could be the weak link in your defense system. It's the single most effective way to prevent the spread of infections, protecting not only yourself but also those around you. It's a fundamental pillar of public and personal health. Finally, the 7th hygiene mistake is overlooking your environment. This one is a bit broader. It's about the cleanliness of the space you live in. A constantly cluttered or dirty home can be another significant indicator of mental or physical health challenges. When someone is struggling with depression, chronic pain, or extreme fatigue, tasks like cleaning the kitchen, taking out the trash, or tidying up can feel insurmountable. This can create an unhealthy living environment, with dust and mold aggravating respiratory issues, and pests being attracted to leftover food. While a doctor won't inspect your home, if a patient mentions feeling overwhelmed and unable to keep up with basic chores, it adds another important piece to their overall health puzzle. It suggests that the person might need more support, not just for their primary complaint, but for their overall ability to function daily. So, let's recap. These 7 mistakes: neglecting oral health, irregular showering, re-wearing clothes, ignoring nail care, sleeping on dirty sheets, improper hand, and overlooking your home environment, more than just bad habits. They are potential signals that something deeper is going on. They can be clues pointing to mental health struggles like depression, physical ailments like chronic fatigue or hormonal imbalances, or a sign that you're simply overwhelmed and not coping well with stress. The key takeaway here is not to feel judged or ashamed. We all have times when our routines slip. The purpose of this video is to encourage If you recognize yourself in several of these points, and it's become a consistent pattern rather than a one-off bad week, it might be time to check in with yourself. Ask why. Are you feeling more tired than usual? Have you lost interest in things you used to enjoy? Are you feeling overwhelmed? Your hygiene is a form of self-care, and self-care is a vital part of healthcare. When you take the time to care for your body, you're sending a powerful message to yourself that you matter. If you're finding it difficult to do that, it's okay to ask for help. Talk to a friend, a family member, or a healthcare professional. They won't judge you for having dirty laundry. They'll see it as a symptom and work with you to figure out the root cause. Taking care of your hygiene can be the first step towards taking back control of your overall health and well-being. Next up, let's talk about something we do every single day. Brushing our teeth. You brush twice a day. You floss. Sometimes you think you're golden, right? Well, not so fast. A huge mistake many people make is not replacing their toothbrush often enough. The American Dental Association recommends getting a new one every 3 to 4 months. or sooner if the bristles are frayed. A worn-out toothbrush doesn't clean effectively, leaving plaque and bacteria behind. And here's something you might not have considered. Where do you store your toothbrush? If it's out on the counter, especially near the toilet, you're exposing it to airborne particles every time you flush. Doctors and dentists call this the toilet plume effect. Gross, right? The simple fix is to store your toothbrush in a closed cabinet or use a toothbrush cover, and always close the toilet lid before you flush. Your mouth will thank you. Alright, moving on to mistake number 3. Overcleaning your ears. I know, it feels satisfying to get in there with a cotton swab, but doctors and audiologists are practically begging us to stop. Your ear canal is self-cleaning. The wax, or cerumen, is actually there for a reason. It traps dust and foreign particles, preventing them from reaching your delicate ear. When you stick a cotton swab in there, you're not really cleaning. You're just pushing the wax deeper, which can cause blockages, muffled hearing, and even painful infections. In worst-case scenarios, you could puncture your eardrum. If you feel like you have excessive wax buildup, don't try to dig it out yourself. See a doctor. They can safely remove it. For daily hygiene, just gently wipe the outer part of your ear with a damp cloth. Ditch the swabs and let your ears do their job. Let us head into the kitchen for our 4th hygiene red flag. The way you handle your kitchen sponge. That little sponge you use to clean your dishes can be one of the germiest items in your entire home. Think about it. It's constantly wet and full of food particles, making it the perfect breeding ground for bacteria. Wiping your counters with a dirty sponge doesn't clean them. It just spreads germs everywhere. Doctors see a lot of foodborne illnesses, and cross-contamination in the kitchen is a major culprit. So, what's the solution? You need to clean your sponge daily. You can zap a damp sponge in the microwave for 1 minute or run it through the dishwasher on the hottest cycle. And even with regular cleaning, you should be replacing your sponge every 1 to 2 weeks. It's a small change that can prevent some serious stomach bugs. Mistake number 5 is a big one, especially for those of us who love our furry friends. Sleeping with your pets. I get it. Snuggling with your dog or cat is comforting. But from a hygiene perspective, it's not the best idea. Our pets walk outside, roll around on who knows what, and can carry bacteria, fleas, ticks, and even parasites. When they jump into bed with you, they bring all of that along for the ride. This can trigger allergies, asthma, and in some cases, lead to skin infections or other illnesses. Vets and doctors often advise creating a separate, cozy sleeping space for your pets. If you absolutely can't part with your furry bedmate, make sure they are regularly groomed, up to date on their flea and tick prevention, and wash your bedding much more frequently in hot water to kill any lingering germs. Now for number 6, and this one might be a little personal, but it's important. Wearing the same pajamas, night after night. We often don't think of our PJs as getting dirty since we only wear them to sleep. But overnight, your body sheds dead skin cells, sweats, and releases natural oils. All of this builds up in the fabric, creating an environment where bacteria can thrive. This can lead to skin irritation, acne, and other infections. Think of your pajamas like any other piece of clothing that's in close contact with your skin. You wouldn't wear the same shirt for a week straight, would you? The general rule of thumb is to wash your pajamas after 3 to 4 nights of wear. If you tend to sweat a lot at night, you should wash them even more often. A fresh pair of PJs isn't just a comfort, it's a key part of good skin hygiene. Let's start with mistake number 1. Neglecting your oral hygiene. We all know that skipping brushing or flossing leads to bad breath and cavities, but did you know it can have far more serious consequences? Your mouth is like a window to your body's health. When you let bacteria build up, you're not just risking a toothache, you're increasing your risk of gum disease, which has been linked to heart problems, diabetes, complications, and even respiratory infections. When you visit a doctor, they often take a quick look inside your mouth. They're not just checking for cavities, they're looking for signs of inflammation, bleeding gums, or excessive plaque. These can be early indicators of underlying issues. For example, persistent gum inflammation can point to poor circulation or even an undiagnosed immune disorder. Swollen or bleeding gums can also be a sign of vitamin deficiencies or hormonal changes. So, the next time you think about skipping that evening brush, remember, your smile is telling a story about your health, and you want it to be a good one. A healthy mouth is the first step to a healthy body. The second red flag: using the same towel for way too long. Be honest, how often do you change your bath towel? If it's not at least once or twice a week, you're creating a perfect breeding ground for bacteria, mold, and yeast. Think about it. You use your towel to dry off, leaving behind moisture, dead skin cells, and natural body oils. This damp, nutrient-rich environment is a paradise for germs. When you reuse a dirty towel, you're essentially rubbing all that bacteria back onto your clean skin. This can lead to skin infections, acne breakouts, and irritation. If you have any small cuts or scrapes, you're even more at risk. Doctors often see patients with recurring skin issues that can be traced back to something as simple as poor towel hygiene. The solution is easy. Wash your towels in hot water at least once a week, and always let them dry completely between uses. A small change for a big difference in your skin's health. Mistake number 3 is a big one, especially in our busy lives. Not washing your hands properly. We touch countless surfaces throughout the day: doorknobs, keyboards, phones, railings. Each touch transfers germs to our hands. A quick rinse under water isn't enough to get rid of them. The CDC recommends washing your hands with soap and water for at least 20 seconds. That's about the time it takes to sing happy birthday twice. Why is this so critical? Your hands are the primary vehicle for transferring germs to your eyes, nose, and mouth, which are the main entry points for viruses and bacteria into your body. Doctors emphasize that proper hand washing is the single most effective way to prevent the spread of infectious diseases, from the common cold and flu to more serious illnesses. It protects not only you but also everyone around you. So, make it a habit. Wash your hands thoroughly after using the restroom, before eating, and after being in public places. Your immune system will thank you for it. Moving on to red flag number 4. Sleeping on a dirty pillowcase. When was the last time you washed yours? Your pillowcase collects a surprising amount of gunk every single night. Sweat, oil from your skin and hair, dead skin cells, and even drool. Just like with your towel, this creates a feast for dust mites and bacteria. All of this buildup can wreak havoc on your skin, leading to clogged pores, acne, and allergic reactions. If you suffer from allergies or asthma, a dirty pillowcase can make your symptoms much worse. Dermatologists often advise patients with persistent acne to change their pillowcases every 2 to 3 days. It's a simple, often overlooked habit that can dramatically improve your skin's clarity and reduce irritation. Don't let your cozy pillow become a source of skin problems. Keep those pillowcases fresh and clean. Hygiene mistake number 5. Ignoring your feet. Our feet do a lot of heavy lifting, but they are often the most neglected part of our bodies. We stuff them into shoes all day, where it's warm, dark, and often moist. The ideal environment for fungal growth. Not washing and drying your feet thoroughly can lead to conditions like athlete's foot and toenail fungus. Podiatrists stress the importance of daily foot care. This means washing your feet with soap and water every day and, crucially, drying them completely, especially between the toes. It's also important to wear clean, dry socks and to give your shoes time to air out between wears. Ignoring foot hygiene can lead to painful infections that are difficult to treat. Furthermore, for individuals with diabetes, even a small cut or blister on the foot can lead to serious complications. So, give your feet the attention they deserve. Clean, dry, and happy feet will carry you far. Next up, red flag number 6. Using your phone on the toilet. Let's be real, a lot of us do this, but have you ever stopped to think about how unhygienic it is? Your bathroom, especially around the toilet, is teeming with airborne germs that are spread every time you flush. These germs, including E. coli, can easily land and settle on your phone. You then carry that phone with you everywhere you touch it constantly. You put it near your face. You place it on your kitchen counter. You're essentially carrying a mobile germ factory. Doctors warn that this habit is a major source of cross-contamination and can easily lead to gastrointestinal illnesses. To break this habit, try leaving your phone outside the bathroom. If you must take it in, make sure to disinfect it regularly with an alcohol-based wipe. Keeping your phone clean is just as important as keeping your hands clean. And finally, Hygiene mistake number 7. Not cleaning your reusable water bottle often enough. It's fantastic that you're staying hydrated and being eco-friendly, but that reusable bottle needs regular cleaning. Just like any other container, bacteria can build up inside, especially around the mouthpiece and in the hard-to-reach crevices. Every time you take a sip, you're introducing bacteria from your mouth into the bottle. Over time, a slimy film called biofilm can form on the inside, which can harbor harmful bacteria and mold. Drinking from a dirty bottle can lead to an upset stomach or other illnesses. T. Solution. Wash your water bottle daily with hot, soapy water. Use a bottle brush to scrub the inside thoroughly. And don't forget to clean the cap and mouthpiece. A clean bottle means clean, refreshing water every time, without any unwanted germs. So there you have it. 7 common hygiene mistakes that could be sending the wrong signals about your health. From your mouth to your feet, and even the everyday items you use, small changes can make a huge impact on your overall well-being. It's not about being perfect. It's about being mindful. Let's start with something you look at every day. Your hands. Specifically, your nails. When you shake a doctor's hand, they're getting a first impression. And it's not just about your grip. They're glancing at your nails, and what they see can tell them a lot. It's one of the quickest ways to assess your personal cleanliness. Think about it. Dirt trapped under your nails isn't just unsightly. It's a breeding ground for germs. Every time you touch your face, your mouth, or your food, you risk transferring those germs. Doctors know that consistently dirty nails can be a sign of overall poor hygiene practices. It's a small detail, but it speaks volumes. But it goes deeper than just dirt. The color and texture of your nails can be a window into your health. For example, do your nails have a yellowish tint? While it could be from nail polish, it's also a classic sign of a fungal infection. If you notice your nails becoming thick, brittle, and yellow, it's definitely something you should get checked out. It's a common issue, but it needs treatment to go away. Then there's the shape. Have you ever heard of spoon nails? It's when your nails become soft and curve inwards, like the bowl of a spoon. This condition, known as koilonychia, can be a red flag for iron deficiency anemia. Your body, ISNT, getting enough iron to produce healthy red blood cells, and your nails are showing the first signs. It is a perfect example of how something that seems purely cosmetic is actually a clue to an internal health problem. And what about the length? Keeping your nails trimmed is more than just about looking neat. Long, untrimmed nails, whether natural or artificial, create more surface area for bacteria and viruses to cling to. It's a simple matter of physics. The longer the nail, the more space there is for germs to hide. Healthcare professionals themselves are required to keep their nails short and clean for this very reason, to prevent the spread of infection. So, what can you do? It's simple. Make nail care a regular part of your routine. Keep a nail brush by your sink and give your nails a good scrub with soap and water every day. Trim them regularly, keeping them at a manageable length. When you do, cut them straight across and then gently round the edges to prevent ingrown nails. Don't forget to moisturize your hands and cuticles, too, as dry, cracked skin can also let in germs. Think of it this way. Clean nails are not just for looks. They are a fundamental part of personal hygiene and a preventative health measure. It is one of the easiest changes you can make to reduce your risk of getting sick and to show that you're on top of your health game. The next time you look at your hands, don't just see fingers and nails. See a reflection of your well-being. This is just the first hygiene habit doctors notice. We've got 6 more to go, and the next one is something you do every single day, probably on autopilot. You won't want to miss it. Alright, moving on to hygiene mistake number 2. This one happens in the bathroom, and it's all about your toothbrush. When was the last time you replaced yours? If you have to think about it for more than a few seconds, it's probably been too long. The American Dental Association recommends replacing your toothbrush every 3 to 4 months, or sooner if the bristles become frayed. Why is this so important? Well, your mouth is home to millions of bacteria. Every time you brush, some of those bacteria get transferred to your toothbrush. Over time, those bristles become a little petri dish. A frayed, worn-out toothbrush is also less effective at cleaning your teeth. The bristles can't reach into all the nooks and crannies to remove plaque, which can lead to cavities and gum disease. And here's something you might not have considered. Where do you store your toothbrush? If it's out in the open on your bathroom counter, especially near the toilet, you might want to rethink that. Studies have shown that flushing the toilet can send a spray of aerosolized droplets, a phenomenon known as toilet plume, into the air. And yes, those droplets can land right on your toothbrush bristles. It's not a pleasant thought, is it? To avoid this, always close the toilet lid before you flush, and consider storing your toothbrush in a closed cabinet or using a toothbrush cover. Just make sure it can air dry completely between uses, as a constantly damp environment encourages more bacterial growth. So, take a look at your toothbrush tonight. If it looks tired and worn, do your mouth a favor and toss it. A fresh toothbrush is a small investment that pays huge dividends for your oral and overall health. Now for a third hygiene red flag, and it's a big one. Body odor. Let's be real, everyone gets a little smelly sometimes, especially after a workout or on a hot day. That's normal. But persistent, strong body odor that is unresolved by regular bathing and deodorant use can be a sign to a doctor that something else is going on. First, it could simply signal that your hygiene routine needs an upgrade. Maybe you're not using an effective antiperspirant or deodorant, or perhaps you're not washing thoroughly enough. Using an antibacterial soap can make a big difference, as it's the bacteria on your skin breaking down sweat that actually causes the odor. However, sometimes a distinct change in your body's scent can indicate an underlying medical condition. For example, a fruity or sweet smell on the breath can be a sign of ketoacidosis, a serious complication of diabetes. Liver or kidney disease can cause your breath or sweat to take on a bleach-like or smell because your body is unable to process and filter out toxins effectively. Certain metabolic disorders can also cause unusual body odors. Your diet plays a role too. Eating a lot of garlic, onions, or certain spices can literally come out through your pores and affect how you smell. While this isn't a medical issue, it's something to be aware of. If you suddenly notice a significant and persistent change in your body odor that you can't explain, and it doesn't go away with good hygiene, it's not something to just cover up with more cologne or perfume. It's a signal from your body. Mention it to your doctor. They can help you figure out if it is just a hygiene issue or a clue to a deeper health concern. Let's move on to red flag number 4. Poor oral hygiene. And we're going beyond just the toothbrush this time. We're talking about bad breath or halitosis and the state of your gums. Chronic bad breath isn't just embarrassing. It's often a sign of a problem. The most common cause is poor dental hygiene. If you're not brushing and flossing effectively, food particles get trapped between your teeth and on your tongue. Bacteria then break down these particles, releasing foul-smelling sulfur compounds. A doctor or a dentist will also look at your gums. Are they red, swollen, or do they bleed when you brush? These are classic signs of gingivitis, the earliest stage of gum disease. If left untreated, it can progress to periodontitis, a more serious infection that can damage the soft tissue and bone that support your teeth, eventually leading to tooth loss. The health of your mouth is directly linked to the health of your entire body. The inflammation and bacteria from gum disease can enter your bloodstream and have been linked to a host of other serious health problems, including heart disease, stroke, and diabetes. So, when a doctor notices signs of poor oral care, they're not just thinking about your teeth. They're concerned about your overall systemic health. The solution: a rock-solid routine. Brush twice a day for 2 minutes. Floss daily, yes. Daily. And use a tongue scraper to remove bacteria from your tongue. And, of course, see your dentist for regular checkups and cleanings. Your smile and your body will thank you. Hygiene mistake number 5 might surprise you because it's not about being dirty, but about being asterisk to asterisk clean. I'm talking about overwashing and irritating your skin. In our quest to be germ-free, some of us go overboard. We use a harsh antibacterial soaps multiple times a day, scrub our skin raw, and use tons of hand sanitizer. While this might seem like a good thing, it can seriously backfire. Your skin has a natural protective barrier called the acid mantle. This barrier is made up of oils, sweat, and good bacteria that work together to keep your skin hydrated and protected from harmful pathogens. When you constantly wash with harsh soaps, you strip away this protective layer. This can lead to dry, cracked, and irritated skin. And guess what? Those tiny cracks in your skin are perfect entry points for the very germs you were trying to avoid. Doctors often see patients with contact dermatitis, eczema, and other skin conditions that are either caused or made worse by The signs are obvious. Red, flaky, itchy, and sometimes painful skin, especially on the hands. So, what's the balance? You should absolutely wash your hands thoroughly, especially after using the restroom, before eating, and when they are visibly dirty. But you don't need to use the harshest soap on the market. A gentle, moisturizing soap is often sufficient. And instead of scrubbing your body with abrasive tools every single day, consider doing it just a couple of times a week. After washing, pat your skin dry instead of rubbing it aggressively, and always apply a good moisturizer to help replenish your skin's natural barrier. Play-on is good, but stripped and irritated is not. Alright, on to hygiene mistake number 6. Ignoring your feet. Feet are often out of sight, out of mind, stuffed into socks and shoes all day. First up, and it's a big one, re-wearing dirty clothes. We've all been there. You're in a rush. That shirt on the chair looks clean enough, so you grab it and go. But here's the deal. Even if it looks and smells okay, your clothes are secret collectors of sweat, dead skin cells, and bacteria. Think of your favorite t-shirt as a sponge. Throughout the day, it soaks up everything your body sheds and everything you come into contact with in your environment. When you let those clothes sit, or worse, wear them again without washing, you're essentially creating a 5-star resort for germs. This can lead to some pretty unpleasant consequences. We're talking about skin irritation, rashes, and even fungal infections like athlete's foot or jock itch, especially when it comes to items like socks and underwear. Those pieces are in direct contact with areas of your body that produce the most sweat and are prone to bacterial growth. Re-wearing them is like sending an open invitation for trouble. Doctors actually pay attention to this. When they see a patient with recurring skin issues or signs that personal care might be slipping, it can be a red flag. It doesn't necessarily mean someone is unclean, but it can often point to underlying issues like extreme stress, overwhelming fatigue, or even a decline in mental or physical health. When we're not feeling our best, sometimes the basics, like doing laundry, are the first things to fall by the wayside. So, take a moment and think about your own habits. How long has that pair of jeans been in rotation? When was the last time you washed that hoodie you live in? It's not about being perfect, but making a conscious effort to wear fresh clothes is a simple but powerful act of self. It keeps your skin healthy, keeps unpleasant odors at bay, and honestly, it just feels better. You're not just putting on clean fabric, you're setting a fresh, positive tone for your day. A little bit of laundry can go a long way in protecting your well-being. Now, let's move on to the second mistake, which happens in the one place you're supposed to get clean, the shower. Are you washing your towel often enough? Many people think, well, I'm clean when I use it, so the towel must be clean too, right? Unfortunately, that's not quite how it works. Your damp towel is the perfect breeding ground for bacteria, mold, and mildew. Every time you dry off, you're transferring dead skin cells onto it. Combined with the moisture, it becomes a feast for germs. Using a dirty towel can transfer those germs right back onto your clean skin, potentially causing acne breakouts, skin irritation, or even infections, especially if you have any small cuts or scrapes. So, what's the rule of thumb? Most experts recommend washing your bath towel after every 3 to 4 uses, and make sure you hang it up to dry completely between uses. Do you want to leave it in a crumpled heap on the floor or in the hamper while it is still damp? Giving your towel a chance to air out is crucial to slowing down bacterial growth. And for hand towels, which often get more frequent use by multiple people, you should be swapping them out even more often. Every day or two is ideal. Next, let's talk about your mouth. You brush your teeth twice a day, which is great. But are you forgetting about your tongue? Your tongue is covered in tiny bumps called papillae, which can trap food particles, dead cells, and a ton of bacteria. In fact, a significant portion of the bacteria that cause bad breath, or halitosis, live on your tongue. If you're only brushing your teeth, you're leaving the biggest party of germs untouched. This buildup, often visible as a white or yellowish coating, not only causes bad breath, but can also affect your sense of taste and overall oral health. Over time, it can contribute to a more serious film of bacteria that can spread to your teeth and gums. The solution is simple. Incorporate tongue scraping or brushing into your daily routine. You can use a dedicated tongue scraper, which is very effective, or simply use the bristles of your toothbrush. Gently scrape or brush from the back of your tongue to the front a few times. It takes just a few extra seconds, but makes a massive difference in freshening your breath and improving your oral hygiene. Mistake number 4 is a classic. Not washing your hands properly or often enough. The pandemic certainly made us all more aware of hand washing, but have the good habits stuck? Your hands are the primary vehicles for transferring germs. You touch doorknobs, your phone, keyboards, and then you touch your face, your eyes, your mouth. This is how colds, the flu, and other viruses spread so easily. The key is not just to rinse, but to wash thoroughly. That means using soap and warm water and lathering up for at least 20 seconds. A great way to time this is by singing the happy birthday song twice. Make sure you scrub all surfaces. The palms, the back of your hands, between your fingers, and under your fingernails. And when should you wash? Definitely after using the restroom, before eating or preparing food, after coughing or sneezing, and after being in a public place. It is one of the single most effective ways to prevent illness and protect not only yourself, but also those around you. Let's move on to something that's on your bed. Your pillowcase? You might change your bed sheets regularly, but how often are you swapping out your pillowcase? Think about it. Your face is pressed against that fabric for roughly 8 hours every single night. During that time, your pillowcase absorbs facial oils, sweat, saliva, dead skin cells, and any leftover hair products or makeup. This creates a grimy cocktail that you then press your face into night after night. This buildup can clog your pores, leading to acne and blackheads, and can also irritate your skin. It can even attract dust mites, which are microscopic creatures that feed on dead skin cells and can trigger allergies and asthma. For the sake of your skin and your respiratory health, you should be changing your pillowcase at least once a week, and even more frequently if you have oily or acne-prone skin, or if you're a heavy sweater. It is a small change that can have a surprisingly big impact on your complexion and overall health. The 6th hygiene mistake is neglecting your feet. Our feet do so much for us, yet they are often the most overlooked part of our bodies. We stuff them into shoes, they get sweaty, and we often just give them a quick rinse in the shower. But feet need more dedicated care to stay healthy, because they're often trapped in warm, dark, and moist environments. Your shoes are particularly susceptible to fungal infections, like athlete's foot and fungal nails. Proper foot hygiene means more than just a quick wash. You need to make sure you're thoroughly scrubbing your feet with soap and water every day, paying special attention to the areas between your toes. After washing, it is absolutely critical to dry them completely, especially between the toes, as leftover moisture is what allows fungus to thrive. If you're prone to sweaty feet, consider using a foot powder to help keep them dry throughout the day. And don't forget to keep your toenails trimmed straight across to prevent painful ingrown nails. Giving your feet a little extra TLC will keep them healthy, comfortable, and odor-free. Finally, mistake number 7. Overcleaning? Yes, you can be *2 clean. While hygiene is important, going overboard can backfire. Using harsh antibacterial soaps all over your body, showering multiple times a day in scalding hot water, or excessively exfoliating can strip your skin of its natural oils and disrupt its protective barrier, known as the skin microbiome. This barrier is made up of good bacteria that help protect you from harmful pathogens. When you disrupt this delicate balance, your skin can become dry, irritated, and more vulnerable to infections and conditions like eczema. The key is to find a healthy balance. Use gentle, pH-balanced cleansers instead of harsh soaps for your body. Limit showers to once a day with lukewarm water, and be gentle with exfoliation once or twice a week is plenty for most people. The goal is to be clean, not sterile. Your body has its own amazing defense system, and your hygiene routine should support it, not sabotage it. So there you have it, 7 common hygiene mistakes that could be affecting your health more than you realize. From washing your clothes to caring for your feet, these small adjustments can make a big difference. How did you do? Are there any habits you're going to change after watching this? Let me know in the comments below. I'd love to hear from you. First up, skipping showers. I know. On a lazy Sunday or a work-from-home day, it feels so tempting to just skip it. What's the harm, right? Well, missing one shower isn't the end of the world. Making it a habit can cause some real problems. Over time, that neglect leads to a buildup of sweat, dead skin cells, and bacteria. This lovely combination is the perfect recipe for body odor. But it goes deeper than that. Doctors often see the direct results of this. When you skip showers regularly, you're opening the door for all sorts of skin issues. We're talking about breakouts, not just on your face, but on your back and chest, often called acne. You might also develop itchy rashes, or even fungal infections like ringworm or athlete's foot, especially if you're active. These microbes thrive in warm, moist environments. An unwashed skin is their favorite playground. If your skin constantly feels oily, itchy, or looks red and inflamed, it's a clear sign from your body that it needs a good wash. It's not just about the physical signs either. A consistent pattern of neglecting personal care, like showering, can sometimes be an outward signal of deeper mental health struggles. Doctors are trained to look for these changes in behavior. It can be linked to conditions like depression, severe anxiety, or burnout, where even simple tasks feel overwhelming. So, if you find yourself lacking the energy or motivation to shower for days on end, it might be more than just laziness. It could be a sign that it is time to check in with your mental well-being, and perhaps talk to a professional. Taking care of your body is a form of self-respect, and it's deeply connected to your mental state. Now for mistake number 2. Not washing your hands properly. We heard this a lot over the past few years, but it's a timeless rule. A quick rinse under the water doesn't cut it. Your hands are germ magnets, touching everything from door handles to your phone, which is a breeding ground for bacteria. When you don't wash them thoroughly with soap and water for at least 20 seconds, you're basically giving those germs a free pass to enter your body when you touch your face, eyes, or mouth. Doctors say this is one of the single most effective ways to prevent the spread of colds, the flu, and gastrointestinal infections. So, lather up. Scrub between your fingers, and get under those nails. Mistake number 3 is a big one for your oral health. Forgetting to floss. You might be a diligent brusher, twice a day. But if you're not flossing, you're only cleaning about 60% of your tooth surfaces. That plaque and food debris stuck between your teeth and under the gum line is a feast for bacteria. This leads to cavities between the teeth. But more seriously, it causes gum inflammation, also known as gingivitis. If left untreated, it can progress to periodontitis, a severe gum infection that can destroy the bones supporting your teeth, leading to tooth loss. Dentists can spot a non-flosser a mile away by the state of their gums, often red, swollen, and prone to bleeding. So, make flossing a non-negotiable part of your daily routine. Let's move on to mistake number 4. Reusing your towel too many times. Your bath towel might look clean, but after you use it, it's damp and covered in dead skin cells, creating the perfect environment for bacteria, mold, and yeast to grow. Every time you reuse that dirty towel, you're rubbing that lovely collection of microbes back onto your clean skin. This can lead to acne, skin irritation, and even infections, especially if you have a small cut or scrape. Doctors recommend washing your bath towel after every 3 to 4 uses. And, most importantly, letting it dry completely between uses. Don't just leave it in a damp pile on the floor. Next up, mistake number 5. Neglecting your feet. Our feet do so much for us, yet they're often the most forgotten part of our hygiene routine. Just letting the soapy water run over them in the shower isn't enough. You need to actively wash them with soap, paying special attention to the areas between your toes. After washing, drying them thoroughly is just as crucial. Lingering moisture can lead to fungal infections like athlete's foot. Furthermore, not trimming your toenails properly can cause painful ingrown nails, which can get infected. Podiatrists see the consequences of foot neglect daily, from fungal nails to severe calluses. Give your feet some love. Mistake number 6 might be happening right on your pillow, not changing your pillowcase often enough. Think about it. You put your face on your pillowcase every single night. Over time, it collects sweat, oils from your skin and hair, dead skin cells, and any leftover makeup or skincare products. This creates a dirty surface that you press your face against for hours. For anyone prone to acne, a dirty pillowcase can be a major trigger for breakouts. Dermatologists advise changing your pillowcase at least once or twice a week to keep your skin clear and healthy. It's a simple change that can make a huge difference. And finally, mistake number 7. Using cotton swabs to clean inside your ears. It feels satisfying, but doctors and audiologists beg you to stop. The ear canal is... Using a cotton swab actually pushes earwax deeper into the canal, which can cause blockages, muffled hearing, and even eardrum perforation. You're supposed to have a thin layer of wax. It's protective. It traps dust and dirt and has antibacterial properties. Instead of digging in there, simply clean the outer part of your ear with a washcloth. If you feel you have a serious wax buildup, see a doctor. They can safely remove it for you. So there you have it. 7 common hygiene mistakes that are major red flags for doctors. It's not about being perfect, but about being mindful. Small, consistent efforts in your hygiene routine can have a massive impact on your physical and mental health. Which of these surprised you the most? Let me know in the comments below. First up, let's talk about hair. You might think that having a bad hair day with greasy, unkempt locks is just a style problem or a sign that you're running late. But for a doctor, consistently neglected hair can be a significant clue. It's not about judging your appearance. It's about looking for signs of your overall well-being. When a doctor sees persistently greasy or messy hair, their mind might not just think needs a wash. Instead, they might wonder if there's something more going on beneath the surface. For example, sudden changes in your hair's texture or oiliness could be linked to hormonal imbalances. Conditions like polycystic ovary syndrome or PCOS can increase androgen levels, leading to oilier skin and hair. Similarly, thyroid issues can cause hair to become dry and brittle or, alternatively, excessively oily. So, that change you're seeing in the mirror might be your body's way of sending a message about your hormones. Another major concern for doctors is the connection between hair hygiene and mental health. When someone is struggling with stress, anxiety, or depression, their daily routines are often the first things to fall by the wayside. The energy it takes to simply wash and style your hair can feel monumental when you're emotionally depleted. So, if a patient comes in with hair that looks consistently uncared for, a doctor might gently probe to see how they're feeling emotionally. It can be an outward sign of an internal battle. Think of it as a form of self-neglect that signals a person might not have the capacity for self-care at that moment. This isn't about being lazy. It's a very real symptom of mental and emotional exhaustion. A compassionate doctor sees this not as a hygiene failure, but as an opportunity to ask, how are you really doing? And to open a conversation about mental wellness. Beyond that, the condition of your scalp itself speaks volumes. It's not just about the strands of hair. Things like persistent, severe dandruff aren't just an annoyance. They can sometimes point to an overgrowth of yeast on the scalp or even an autoimmune condition like psoriasis. If you're experiencing an itchy, flaky scalp that doesn't go away with regular anti-dandruff shampoos, it's worth bringing up with your doctor. Likewise, any unusual scalp infections, sores, or significant hair loss could be red flags. Hair loss, in particular, can be triggered by a wide range of issues, from nutritional deficiencies like low iron or vitamin D, to autoimmune diseases where the body mistakenly attacks its own hair follicles. Your doctor can help you connect the dots. So, the next time you're washing your hair, pay attention. Taking care of your hair and scalp isn't just about vanity. It's a fundamental part of your health puzzle. A clean, healthy scalp and strong hair are often reflections of a body that is in balance. It shows you're getting the right nutrients, your hormones are stable, and you have the mental and physical energy for self-care. It's an act of wellness, not vanity. First up, let's talk about something we all do every day. Showering. You hop in, lather up, rinse off, and you're good to go, right? Well, not so fast. A huge mistake many of us make is using the same loofah or washcloth for weeks or even months on end. Think about it. That warm, damp environment is a perfect breeding ground for bacteria. When you scrub your body, you're not just cleaning it. You could be spreading those germs right back onto your skin. This can lead to skin irritations, infections, and even acne breakouts. Dermatologists recommend replacing your loofah every 3 to 4 weeks. If you use a washcloth, make sure you're using a fresh one every single day and washing it in hot water. It's a simple change that can make a huge difference for your skin's health. Moving on to number 2. how you brush your teeth. We all know we're supposed to brush twice a day, but are you doing it correctly? A common mistake is brushing too hard. Many people think that applying more pressure means a deeper clean, but it's actually the opposite. Aggressive brushing can damage your tooth enamel, which is the protective outer layer of your teeth. Once it's gone, it doesn't grow back. This can lead to sensitivity and increase your risk of cavities. It can also cause your gums to recede, exposing the sensitive roots of your teeth. Dentists advise using a soft bristled toothbrush and using gentle, circular motions. Think of it as massaging your teeth and gums, not scrubbing a dirty pot. Let the bristles do the work, not your muscles. The third mistake is all about your ears. Are you someone who reaches for a cotton swab to clean out your ears? Stop right there. While it might feel satisfying, doctors and audiologists strongly advise against putting anything smaller than your elbow in your ear canal. Pushing a cotton swab in can actually shove earwax deeper into the canal, causing blockages, muffled hearing, and even potential damage to your eardrum. Your ears have a natural self-cleaning mechanism where the wax slowly moves from the inside out, carrying dirt and debris with it. If you feel like you have a buildup, a safer way to clean the outer part of your ear is with a damp cloth. If you suspect a blockage, it's best to see a doctor who can safely remove it. Alright, mistake number 4. Neglecting your tongue. When you brush your teeth, do you also brush your tongue? If not, you're missing a crucial step. Your tongue's covered in tiny bumps that can trap food particles and bacteria. This buildup is one of the main causes of bad breath, or halitosis. Over time, it can also affect your sense of taste and overall oral health. It's not just about fresh breath. It's about removing bacteria that can contribute to plaque and other dental issues. You can use your toothbrush to gently brush your tongue from back to front, or you can get a dedicated tongue scraper. It only takes an extra 10 seconds, but it makes a world of difference for your mouth's freshness and cleanliness. Let's move from the top of your head down to the bottom. Your feet. This is hygiene mistake number 5, and it's a big one. Feet are often overlooked, but they're prone to infections, odor, and skin problems. Doctors check for signs like cracked heels, fungal growth, or swelling, all of which can indicate poor hygiene or even circulation issues, especially in older adults. Foot neglect can lead to very serious complications. The area between your toes is particularly vulnerable. If you don't dry it properly after a shower, that trapped moisture can lead to athlete's foot, a pesky and itchy fungal infection. A simple daily habit can prevent so many problems. Wash your feet every day. Take the time to dry thoroughly between the toes, and choose shoes made of breathable materials. Don't let your feet be the forgotten part of your health routine. Number 6 has to do with your hands, but not in the way you might think. We all know to wash our hands, but what about what's asterisk? Under asterisk, your fingernails. Your nails can harbor an incredible amount of dirt and germs. When you scratch an itch, touch your face, or prepare food, you could be transferring those germs. This is a red flag for doctors because it's a direct route for spreading infections. You don't need long, fancy nails to have this problem. Even short nails can collect grime. The solution is simple. When you wash your hands, pay special attention to scrubbing under your nails with soap and water. A nail brush can be a fantastic tool for this. Keeping your nails trimmed and clean is a small detail that has a big impact on your personal hygiene and the health of those around you. And finally, the 7th hygiene mistake: overwashing your hair. It sounds counterintuitive, right? How can being asterisk to asterisk clean be a problem? Well, washing your hair every single day can strip your scalp of its natural oils, called sebum, is essential for keeping your hair moisturized and your scalp healthy. When you strip it away constantly, your scalp can go into overdrive and produce even more oil to compensate, making your hair greasier faster. It can also lead to a dry, itchy scalp and brittle, lackluster hair. Of course, everyone's hair type is different. If you have very oily hair or work out intensely every day, you might need to wash it more often. But for many people, washing every other day, or even a few times a week, is much healthier. Try to extend the time between washes and see how your hair and scalp respond. You might be pleasantly surprised. So there you have it, 7 common hygiene mistakes that doctors see as red flags. From your feet to your hair, these small adjustments can have a massive impact on your health and well-being. It's not about being perfect. It's about being mindful and making smarter choices for your body. Which of these mistakes were you surprised by? Let me know down in the comments. Let's jump right in with our first red flag. Neglecting your tongue. You brush your teeth twice a day, you floss, but what about that big muscle in your mouth? Your tongue is a breeding ground for bacteria. It has all these tiny bumps and crevices where food particles and dead cells get trapped. When this gunk builds up, it doesn't just cause bad breath, or halitosis, as the experts call it. It can actually contribute to a host of oral health problems. Think about it. All that bacteria is just sitting there, ready to migrate to your teeth and gums, potentially leading to plaque buildup and even gum disease. Doctors, especially dentists, can often tell if you're skipping this step just by looking. So, what's the fix? It's simple. Get a tongue scraper or just use your toothbrush. After brushing your teeth, gently scrape or brush your tongue from back to front. It only takes a few extra seconds, but it makes a world of difference for your breath and overall oral hygiene. Moving on to mistake number 2, using the same towel for too long. We've all done it. You hop out of the shower, dry off, hang the towel up, and repeat the next day. And the next. But here's the catch. Every time you use that towel, you're transferring dead skin cells, bacteria, and moisture onto it. A damp towel hanging in a steamy bathroom is the perfect 5-star resort for mold, yeast, and bacteria to grow and multiply. When you reuse it, you're essentially rubbing all that nastiness right back onto your clean skin. This can lead to skin irritation, acne breakouts, and even minor infections, especially if you have any small cuts or sensitive skin. Doctors often see patients with unexplained skin issues that can be traced back to this simple habit. The recommendation: you should be washing your bath towels after every 3 to 4 uses, and make sure you hang it up to dry completely between uses. Spreading it out on a towel bar is much better than hanging it on a hook where it stays bunched up and damp. A little extra laundry is a small price to pay for healthier skin. Alright, let's talk about something we touch all day every day: your phone. This brings us to hygiene mistake number 3. Forgetting to clean your electronics. Your smartphone is probably one of the dirtiest items you own. Just think about it. You take it everywhere: the kitchen, the gym, the office, and yes, even the bathroom. Studies have found that phones can be covered in more bacteria than a public toilet seat. That's a pretty gross thought, right? You touch your phone, then you touch your face, you eat, you rub your eyes. You're basically giving all those germs a direct shuttle service to your body. This can lead to everything from acne breakouts, especially on your cheeks and jawline, to more serious illnesses. Doctors are increasingly aware of fomites, objects that can carry infectious agents, and our phones are prime culprits. The solution is easy. Get some electronic-safe cleaning wipes, or use a microfiber cloth, lightly dampened with a 70% isopropyl alcohol solution. Make it a daily habit. Maybe at the end of the day when you're winding down. Clean your phone, your tablet, your keyboard, and your mouse. It's a simple step that significantly reduces your exposure to germs. Next up, mistake number 4. Sleeping on a dirty pillowcase. You spend about a third of your life with your face pressed against your pillow. Even if you wash your face before bed, your pillowcase still accumulates a nightly collection of dead skin cells, oils from your skin and hair, sweat, and drool. Over time, this creates a buffet for dust mites and bacteria. All of this can clog your pores, leading to acne, blackheads, and skin irritation. It can also aggravate allergies and asthma. A doctor might not ask about your laundry schedule, but if you're dealing with persistent skin issues or respiratory irritation, your bedding could be the hidden cause. So, how often should you change it? The consensus among dermatologists and allergists is at least once a week. If you have particularly oily skin, acne-prone skin, or severe allergies, you might even want to change it every 2 to 3 days. It sounds like a lot, but think of it as a mini facial you give yourself every night. A clean pillowcase means a cleaner, happier face in the morning. Let us head back to the bathroom for mistake number 5. Storing your toothbrush in the wrong place. Where do you keep your toothbrush? If it's sitting in a cup on the bathroom counter, especially near the toilet, you might want to rethink that. Every time you flush the toilet with the lid open, a plume of aerosolized particles containing whatever was in the toilet bowl sprays into the air. This toilet plume can travel up to 6 feet and settle on all the surfaces in your bathroom, including your toothbrush. I'll let you imagine what those particles contain. It's a direct route for bacteria to enter your mouth. Doctors are all about preventing the spread of germs, and this is a big and frankly disgusting oversight. The best practice: first, always close the toilet lid before you flush. It's a game changer. Second, store your toothbrush upright in a holder where it can air dry, and keep it as far away from the toilet as possible. You could also store it in a medicine cabinet to give it extra protection. And don't forget to replace your toothbrush every 3 to 4 months, or sooner if the bristles are frayed or if you've been sick. Now for a habit that feels clean but can actually be harmful. Mistake number 6 is overcleaning your ears. Many of us grew up using cotton swabs to dig out earwax, thinking we were keeping our ears clean. But doctors, particularly ENTs, will tell you this is a huge mistake. Your ears are self-cleaning. Earwax, or cerumen, isn't dirt. It's a natural, protective substance. It has lubricating and antibacterial properties, and it helps trap dust and debris, preventing them from going deeper into your ear canal. When you stick a cotton swab in there, you're usually not removing the wax. Instead, you're pushing it further down, which can lead to impact. This can cause pain, hearing loss, ringing in the ears, and dizziness. Even worse, you risk scratching the delicate skin of your ear canal or, in a worst-case scenario, perforating your eardrum. So, put down the cotton swabs. To clean your ears, simply wash the external part with a washcloth. If you feel you have excessive wax buildup, see a doctor. They can safely remove it for you. Remember the old saying, don't put anything smaller than your elbow in your ear. Finally, let's talk about our hands. Hygiene mistake number 7 is improper hand washing. We all know we're supposed to wash our hands, but are we doing it correctly? A quick rinse under the water isn't enough. The Centers for Disease Control and Prevention, the CDC, has very specific guidelines for a reason. Improper hand washing is one of the main ways infectious diseases spread, from the common cold to more serious viruses. Doctors see the consequences of this every single day. A proper hand wash should last at least 20 seconds. That is about the time it takes to sing happy birthday twice. You need to use soap and water, and you have to be thorough. Lather up the backs of your hands, between your fingers and under your nails. These are the spots people commonly miss. Then rinse well and dry your hands with a clean towel or an air dryer. It's one of the simplest, yet most powerful, actions you can take to protect not only your own health, but the health of everyone around you. Don't just do it after using the restroom. Do it before you eat, after you sneeze or cough, and whenever you come in from outside. So, how many of these hygiene mistakes are you guilty of? Don't worry. Awareness is the first step to improvement. It's not about being perfect, but about making small, consistent changes that add up to a big impact on your health. By fixing these habits, you're not just looking and feeling better. You're actively protecting your body from germs and potential health issues. Doctors notice the little things that you might overlook, and now you can too. Start with 1 or 2 of these tips and build from there. Maybe start by cleaning your phone tonight or committing to changing your pillowcase this week. Every little bit helps. If you found this video helpful and maybe a little eye-opening, please give it a thumbs up and share it with friends and family who might benefit from these tips. And don't forget to hit that subscribe button and ring the notification bell so you don't miss out on more wellness tips to help you live your healthiest life. We love having you as part of our community. Thanks so much for watching. Stay clean, stay healthy, and stay curious. See you in the next video.